We have courses for nurses, we have courses for social workers. This is a course for all human beings. And what an amazing group from so many fields. And there are veterans here, people who have been working in palliative care for many, many years. Dr. Ajay as a volunteer. How many years? Sneha has been traveling through the country, advocating for palliative care for how many years? I can't remember. There are I'm sorry, I'm not mentioning everyone. So many people are here. And between us, we are going to change the world. I truly believe that. I know that we have spent about 1 hour just getting to know one another. I think that's time well spent because most of these people, I'm sure, are going to be together in this activity for a long time. Shreya, at the end of it, we may not have a lot of time for discussion today. So right now, I would request everyone, because we have spent this 1 hour on introductions, we'll have to stop in half an hour. In between, when you have questions, do please note them down or put it in the chat. And next session, we'll have to handle the questions.
Yes, sir.
So, with your permission, I am going to share the screen. I hope that is visible. And as you can say, I truly believe palliative care is everybody's business. I have given this talk the title Moving the Margins of Healthcare, and I'm going to explain why I say that. Why together this group has to move the margins of healthcare from what it is, that narrow margins now. And I'll start with this question to you. Does today's healthcare system provide healthcare? Silly question, but just give it a thought. Does it? This is health by the definition by World Health Organization: complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When you go to the hospital with a cold, or when you go to the hospital with your parent with dementia, when Pranab Basu walked around the corridors of cancer hospitals for a long time with his wife with cancer, did the hospital really provide healthcare? I have asked this question to a lot of people, mostly to healthcare professionals. If I ask medical students or young doctors what is health, they will all recite this definition because they have all learned this in their community medicine classes. But when I ask, really, is this what your hospital really provides? Do you provide steps to assess and provide physical, social, and mental well being? Then there is a silence. When there is that silence, I would have dealt with this silence today if we were not left with so little time. But I have to move on. A usual answer after some shuffling of feet is a criticism of the definition. Complete well being is not achievable. That one word, I agree, is superfluous and a problem. And very often, that presence of that word complete is the excuse given for not taking the definition seriously. And then I ask, that's okay. Let us always aim for complete well being. We'll fall short of it. That's okay. Can't we still try to provide that well being? More shuffling of feet, but when I insist on answer, it's not easy. Giving measures that physical, social, and mental well-being is not easy. That's true. Diagnosing diseases, treating diseases is easier. There are protocols. And what is not said is, it is not really profitable either. You do an endoscopy, you do a surgery, 2 hours time spent, so much billing can happen. How much can you charge for a counseling session? No match. So when I say it doesn't have to be easy, health is defined as this. This is what the person needs. We should do only the easy things. Somebody will have to do the more difficult things. And anyway, if we try it, many things may be easy. And finally, they say, no, a state of complete physical, social, and mental well-being is not achievable. I'll say, okay, let us not insist on the complete. Let us provide as much well-being as possible. No, it is not achievable. This is impossible. From easy, it is upgraded to impossible. And then I would tell them one of my many stories. Today, I have chosen the story of Shanta. I'm stopping, Shreya, I'm stopping the screen sharing for a minute. I'll come back to it later so that I can look at everybody and speak. Shanta was introduced to us. This must have happened about 4 years back. Volunteer rang one day and said, I have this young woman, she is about 40, with cancer, advanced cancer. She is bleeding. She is in pain. She has lost all her records. So the cancer hospital is refusing to see her. Can you please do something? Listen, it was not a doctor referring. It was not a nurse referring. It was a human being making the referral. I said, by certainly, bring her along. So she brought her. Shanta came. Shanta came and gave us some stories about how she lost the records, etc., etc. But that's okay. Even if you have lost the records, tell me, who did you go to? I'll talk to the cancer hospital and try to find the records. She wouldn't give the details, and her story went on changing. She was clearly telling us lies. It was very obvious. A medical social worker with us sat down with her and said, Chechi, there is something that's bothering you a lot. Chechi, by the way, in Malayalam, our language means elder sister. Chechi, tell me, what is it? Let me try to help. Tell me what's bothering you. And then the true story came out. She didn't have cancer. What she had was a pregnancy. This was a single mother, abandoned by the head of the household when the kids were small. This woman worked as a housemaid, earned money, put those two girls to school. They are teenagers now. I saw them that evening when they came after school. Two smart kids in high school. These two kids was her life. And now, somehow, she was trying to raise the family. As the girls got into higher school, the expenses rose. She was emotionally destroyed. And in the course of it all, she got pregnant. A lot of people would be judgmental about a single woman getting pregnant in our society. They wouldn't be judgmental about a society that is deserting that woman to fend for the two children on her own. But when she gets pregnant, there will be a lot of people who would have their moral righteousness boiling. This woman had a threatened abortion. That's what she was incomplete abortion. That is what was causing the bleeding. She had aborted, but not completely. I won't go to the lengths that we went. That social worker established a relationship with her. We found a gynecologist who always helps us in difficult situations. This girl said, I will not come to any hospital in this city. You do what you can here. We couldn't do a surgical procedure there and evacuate the uterus. Actually, this uh, gynecologist, another human being, drove 30 kilometers to the neighboring town to a friend's hospital. We sent the woman with a caregiver to that town. There she had the abortion evacuated. And I am proud to say we are supporting the education of those two children because our volunteers group doesn't stop by caring for patients. Palliative care for patients and families, including the children. We would look after those children's education till it is complete. Now, I told you Shanta's story because most of medicine that I learned in medical school wouldn't have helped Shanta. We certainly treated her pain, but getting her to the neighboring town where nobody would know her, arranging the human gynecologist who would do the procedure for her at no cost, supporting the family, giving her that emotional strength. And on the third day, she confessed to the social worker she had bought poison to give to the children. She said she would decided she would give poison to them, make sure that they are dead, and then hang herself. But after she had bought the poison, she couldn't force herself to give it to her own kids. Therefore, she didn't do it. Palliative care, by definition, is a for WHO definition is for life-threatening illnesses. Tomorrow, I mean, at the next session, my colleague will Smriti Rana will explain in detail what palliative care is. No, we will not get there today. But did she have a life-threatening disease? Here it was threatening 3 lives, not the illness, but the social issues. I wanted to tell you this story specifically to explain that medicine is incomplete to provide health. Health for Shanda and her 2 teenage daughters meant doing all this. Shreya, can you please share the video?
So we'll be sharing the video on the WhatsApp group, sir, if that's okay. Because we don't have much.
Okay.
Yeah.
It is only 5 minutes, but you have decided you are the boss. Okay.
Yes, sir.
So the video, okay, that puts me uh, off track a little bit because here is a video that she will send you that explains the concept of total pain, what Shanta is having. That is the conglomeration of the physical suffering, social suffering, emotional suffering, and spiritual suffering. Certainly, Shanta's bleeding and pain. This was a small part of her problems. The social isolation that she had, the stigma of a self righteous society, the anguish, the concern for the kids, the self hatred for a teenage. What she said was, if my children come to know that I am pregnant, then you will have to look after the children because I won't be on this world anymore. She was ashamed. She felt death was better than life. All this together is her suffering. Why am I saying this? The majority in this group are not medical professionals. I am saying that for a lot of people, including this man, we doctors and nurses can take a part only in a small part of their suffering. Most elements of suffering are things that can be done and can be done only by human beings. Whether they are professionals or not, that doesn't matter. We need humanity to sort this out. This is why I started with the sentence palliative care is everybody's business. And if we have this discussion coming back towards the end, I would say healthcare should be everybody's business. But this is by no means to underestimate the importance of the physical suffering. Because for this man in pain, nothing will enable us to enter his mind, and his mind space is full of the pain. Pain, physical pain, is something that leaves no space for anything else. He will not bother about the family. And actually, this man's family said he was such a loving person. And now he doesn't care for us. He always shouts at us. But that's the way physical suffering behaves. So, by no means the importance of physical suffering. Pain and other symptoms need to be treated, and that is so inexpensive. Getting this man to sit up and have enjoying his first cup of tea in 3 weeks cost us only 5 rupees and 1 hour. This is what is denied to 98% of people in pain. This is what we all together will advocate for. But once the physical pain is treated, we all will have to get together. I started by asking a question. Does today's healthcare system provide healthcare? There are several problems there. One is that we already mentioned. We do not treat pain and other physical symptoms. We do not treat suffering. We look at diseases, and that's all. That's one error of commission. I'll add a second error of commission. Marginalized people are left behind. We look after the majority. We look after people who have a vote bank. How about people left out there in the jungle? What access do we give them? I already told you about Shanta, how she was discriminated against. Children, elders. There are people working specifically with elders here. They know the degree of suffering. They are marginalized. Even the other day, I won't mention the country. It was a few months back. A minister of a South American country came out with a public statement is that let us not say that COVID-19 is bad. It has its positive points because it specifically kills the elderly and the ailing. So we will have a more productive society left behind at the end of it. How do you like that? We do discriminate a lot of people. We don't even have to say how culturally isolated people are discriminated against. We laugh at tribals, exploit them, convert them to addicts. We corrupt them so that we can earn more money. And people with different sexual orientation, lesbians, gay, bisexual, transgender, queer, intersex people, we have seen the extent of misery perpetrated on them by a self-righteous society. And how many of us are willing to go and look after prisoners in jails, suffering like hell? And if they give risk to us, like people with HIV, multiple drug-resistant tuberculosis. There is at least one person in the group who works with people who have addiction issues. Don't they have serious health-related suffering? Shouldn't they get a rational treatment? We actually know how they are treated. It is horrendous in our country. The way we deal with people with addiction issues is horrendously cruel. And people with chronic pain issues, marginalized. People with disabilities, 3rd December is World Disability Day. Maybe a moment to think about it. People with mental illnesses, the kind of stigma they go through. So this is another error of omission of the healthcare system. I started by saying that we don't treat suffering, we treat only diseases. And even that we do only for people that are convenient to us, who are well enough to come to our healthcare palaces. And specifically women's issues. We talk about autonomy. How many women in our country have control over their own lives? What do you think, majority or minority? Their autonomy is stolen or they give up because that's a culturally appropriate thing. Like Shanta, many are abandoned. If there is an illness, the woman, if there is there, she bears a child with a birth defect, they are abandoned. And a single woman like Shanta is hunted in our society, our male dominated, self righteous society. And then it's all her fault. And several people mentioned caregiving. Many here are caregivers, and their suffering is mute. Except in fora like this, those their voice is not heard, it is deliberately silenced. You met Ashla a few minutes back. Ashla introduced herself. Ashla, hi, Ashla, you have been with us for 6 years now, right? Ashla was a software professional. She 6 years back, I think she will be doing one session for you, and I don't think she minds her story being shared. She fell off a train, broke her neck, and became a quadriplegic. She spent 3 years in hospitals and rehabilitation centers. Then she came to us. Today, she is the winner of Kerala government's Youth Icon Award. She is one who counsels so many children or families. If they feel sad, they call Ashla Chichi. If they feel happy, they call her. She counsels people, other people with disabilities. She was working as my executive assistant for a long time. She is still that, but she is grown to be a trustee of Palliative India. And when I desperately need it, she counsels me also. What am I saying? Ashla shows us that despite having a serious disability, life can be fruitful. She addressed a gathering of about 1,000 people, and I remember what he said. She was sitting in her wheelchair and saying, if you give me a choice, I would like to get up and walk again. But it is equally true that my life in the last 2 years has been more meaningful than my life in the 28 years when I walked. What we are trying to do is, whatever be the healthcare issue, whatever be the disability, whatever be the illness, whatever be the mental status, if we give them love, care, care with your smile, I believe it's possible to have a meaningful life. And I wanted to share that smile with you, which was possible even with all the physical problems. We also have some errors of commission where we provide inappropriate end of life care. We may get to talk about it on another day. I see that we have only 8 minutes more. Uh, maybe we need to talk about this in detail. Maybe among the attendees, those who are not afraid to think about your own death, maybe give a thought to where you would like it to be. Gina, who is participating here, has actually written an article in the Hindu about it. Maybe Shreya, we can share that link with everybody later.
Will do so.
Uh, I know I wouldn't want to end up like this. I'm an anesthetist by training. I was an intensivist. I know that intensive care can save lives miraculously. I also know that it can inflict the horrendous punishment of a tortured death in an ICU, separate from the family, where the only thing that matters is the love that you give and the love that you get. This is a horror. And uh, sorry, I wish I had not shown that arrow. This is where India is. Among the worst 15 countries in ranking end of life care across the world. We do not treat suffering, we inflict punishment. It doesn't happen in every country. Uh, oh, sorry. Who came from USA? Uh, the Texan. In USA, it doesn't happen. There, the majority of people are weaned off ventilator if their treatment, if their IC intensive care is futile, then they are given palliative care. But here, we allow them to die on ventilators, even with advanced cancer, even with advanced dementia. That's a horrible thing to do. And we drive people to poverty. 55 million Indians are pushed below poverty line every year in our country. These are some horrors that today's healthcare system inflicts. These are things that we together have to change. This will not be achieved in my lifetime. This will not be achieved in your lifetime either. But in our lifetime, we would have walked many steps ahead of this. We will achieve it to some people and then it will expand. We have this official definition of a healthcare provider's duty of care from Indian Council of Medical Research. It is to mitigate suffering. It is to cure sometimes, relieve often, and to comfort always. And the ICMR adds there exists no exception to this principle. This is what we are going to do. When it's possible to cure, we should. We should always relieve suffering and we should always provide psychosocial support. And this is what the world is asked to do. World Health Assembly asked all member countries to integrate palliative care into healthcare, not only to create palliative care units, but to combine it with all healthcare, primary, secondary, and tertiary care across the continuum of care, from the beginning of the illness to the end. If we are to do that, the palliative care approach is essential. Pallium India runs a palliative care unit. Many there in Kerala, there are about more than 450 palliative care centers. In the rest of the country, there is a significant number, but that won't achieve it. The basic thing will be every clinician, every healthcare provider uses the principle when they are treating any patient. For example, if a young man or a young woman is going to a doctor with a cold, sneezing about 73 times a day, rather than just prescribing a tablet of cetirizine, if that doctor asks, you look particularly anxious, is there a problem? Then the person will say, I have an important examination today. This is the last day of the examination. I'm worried. Then the doctor changes that prescription and gives a non-sedating antihistaminic because the man has an exam. That is palliative care approach. The oncologist or the neurologist treating dementia, thinking in the patient's comfort, thinking in the caregiver's comfort, that's palliative approach. So what we want is not only a lot of palliative care units, we want palliative care approach. But as my final message, let me add, this is possible only with engagement of the community. Our work together, this group will lay the foundation. Because what I am recommending cannot be done by professionals alone, as Shanta's story has showed us. 12th December is Universal Health Coverage Day. 2 years back, world nations got together at the capital of Kazakhstan and came out with statements. Health for all can be achieved only if it's health with all. Each one of us, Marisha, Harpreet, and all the other 40 people here, we all need to be together. Every human being has a role in this. Healthcare for all can be only healthcare with all. The patient and family at the center. We, the members of the community around them, and healthcare system supporting from afar. And Standard Krishna actually asked us to include the community in designing and controlling health systems. Shanta's and two children's lives were saved, yes, by the gynecologist also, but primarily by that volunteer in the community who cared enough to support her, enough to get her to us. I'll stop now that the time is up with that final message. Healthcare for all has to be healthcare with all. I'll also take a minute to show my final slide. You will all do many things in palliative care. You will create palliative care centers. You will create dementia centers. You will create old age centers. I loved hearing about that assisted living center. You must also tell me how much it costs. I want to book a seat there. But we all have to be advocates. This business of healthcare for all, true healthcare, not only medical support, true healthcare for all can be achieved only by advocacy. As Gina wrote in the newspapers, whoever can write about it, not necessarily in newspapers, social media, share your stories. People need to hear this. We need to engage the politicians, bureaucrats, everybody. I have been thrown out of many meetings, many rooms, denied entry. But we have a right to be heard. If I am thrown out of one room, I look for another room where I can be heard. And we'll engage the visual media also. So powerful. Faye D'Souza, who did several programs on palliative care. So, with that plea to everyone, not only to be partners in healthcare, but to be advocates, I'll stop for the day. Thank you very much for listening to me patiently. And I'm sure Shreya will be happy to send you the presentations. Some of the pictures may be big size, may not be easily sent. We may have to take them out, but we'll share this. I wish we could have the discussion today, Shreya. Hopefully, when Smriti does the introduction to palliative care next week, Next week, is it?
Yes, sir.
Next
5th
Saturday.
December. Yeah.
So hopefully you will allow me to come in and listen to this if I am free at that time.
Sure.
I am looking forward to further discussion on these things.
Yes.
And please share that 5 minutes clip with them so that they can all watch it and understand what total pain is about.
So the clip is shared on the WhatsApp group.
Okay.
Thank you so much, Dr. Raj. Thank you for taking out the time. And please do join us next week. I think now we are going to have more discussions. Sorry, unfortunately, we don't have time for discussions today. Do fill in the feedback form that's shared in the chat box. It will be shared on the WhatsApp group. We have a feedback form after every session. Also, next week, we will be meeting again on 5th of December. Please don't worry. All the slides and the learning points will be shared with you through mail. So you won't be missing out on anything. And also just emphasizing, Dr. Raj, we do have an end-of-life care session towards the end of the program, which Dr. Raj would be taking in detail as well. So thank you, everyone. Thank you for joining us in this beautiful afternoon. Stay in touch, keep well, and have a lovely, lovely weekend. Thank you so much. Thank you.
Thank you.
Thank you so much, Shreya.
Hey, bye-bye.
Thank you,
Thank
everyone.
you, Tom.
Thank you very much.
Bye, everybody. Thank
Bye-bye,
you.
everybody.
Thank you. Thank you very much.
See you on 5th December.
Thank you.
Yes, 5th December, Saturday, 3 to 4:30.
Thank you. Thanks a lot.
Shreya, just share the feedback on the WhatsApp group also.
Yes, I'll share the feedback link on the WhatsApp group.
Yeah,
We can leave
because-
the meeting now. Thank you so
Yeah,
much.
yeah. Thank you, ma'am.
Thank
Thank
you.
you. Thank you, sir.
Just staying back to read the chat box.
Yes, that's why I'm not closing the meeting and seeing the beautiful smiling faces in the end.
Shishir ji, I don't know if you're still here. I see that comment about quadriplegia. I didn't know. Who was the one who was doing the going to create an assisted living place?
Samuel.
Adiba?
Yes, sir.
Just a tentative reservation for me for the future.
And yeah, you've got a lot of places to go to actually, so.
No, first choice is with you all, Shreya.
Yes. So let me know. I can close the meeting once you finish reading the chats.
But you have a record of the chat messages.
Yes, I do.
Because Samuel has asked something important, which has to be pursued. I really do not know the identified scales that he is talking about. I must express my ignorance.
Yeah.
So that is something to be pursued with Sam.
Okay.
Runa Mitra, Runa has done our 6 weeks course. You know that? Long time back.
Oh, really? Okay.
Yeah.
Yes. Yes, sir.
Runa, good to see you, yeah.
Yes, sir.
How are you?
Me too. Fine, sir. How are you, sir?
Good. How is
Thank
Dr.
you.
Sankhamitra?
Very good.
Okay, Shreya.
Thank you so much,
Thank
everyone.
you.
I'm going to close the meeting and I'll share all the information. Thank you so much.
Hi,
Thank you.
Geetanjali. Bye-bye.